morning, APOSI peeps. Welcome back to our Wednesday Wellness webinar. Our topic for today is all about rumination. I am Mary Queen Casabuena, your speaker for today. For our discussion outline, we have the overview of rumination, the symptoms, causes, complications, prevention, and the treatment. It is a condition, rather, in which people repeatedly and unintentionally spit up or regurgitate undigested food or partially digested food from the stomach, rechew it, and then either reswallow it or spit it out. Rumination is a behavioral problem. So people here are eating normally, but then after 1 to 2 hours, the undigested food comes back from the mouth that came from esophagus, and then they will rechew it, reswallow, or they will spit it out. Rumination is a reflex and it is not a conscious action. So what are the symptoms? Patients who have rumination regurgitate and rechewing food on a regular basis. So this happens every time they eat. Another symptoms is they have digestive problems like indigestion and stomach aches. For dental problems, they are experiencing tooth decay and bad breath. Another symptoms is weight loss, and lastly, chapped lips due to dehydration and malnutrition. For the causes, they have severe stress, rejection from the family or loved ones, previous eating disorder like anorexia nervosa, lack of environmental stimulation, and neglect. For complications, they are experiencing embarrassment because anytime or if they eat, they will just regurgitate without time at all. So they are also experiencing poor nutrition and failure to grow. Another complication is electrolyte imbalance and dehydration. They are also experiencing choking if they eat, since mababa ng immune system nila kasi they have poor nutrition and malnutrition, so they are very susceptible to any diseases. Example of this is pneumonia, and worst is it will lead to death. For the prevention, it may be possible to reduce the risk of rumination syndrome by learning more positive coping strategies for stressful situations. That's why patients' cooperation for the treatment and therapy is very important. And for the treatment, we have medication. For medication, age and general health of the patient and severity of the condition is very important. For those who are often having rumination, the doctor will give them Nexium and omeprazole. Also, they are taught of behavioral therapy. Example of this is diaphragmental breathing. So this is a breathing using abdominal muscles, a proper breathing in and breathing out. For kids, they are taught of biofeedback. Pictures are shown to them how to do diaphragmatic breathing to counteract regurgitations. Also, the babies are experiencing rumination. So for the babies, parents and caregivers are taught how to do environmental change for the infants and their behavior. So that ends my presentation. The best way to stop rumination is to relearn how to eat and digest food correctly. So this requires, as what I've said, diaphragmatic breathing training. If you have any questions, suggestions, or clarifications, please feel free to reach out the clinic team. For our next week topic, we have asthma. So that ends my presentation. Thank you for your time and have a great day.